Good afternoon and welcome. My name is Ryan Tappy and I work with the ALS Association. Thank you for joining us for this ALS Association webinar. There are a few things we want you to know before we begin. There will be time at the end of this webinar for questions. You should see on your screens an option for Q&A. You can type questions you have there at any time and we will review them at the end of the webinar to provide answers. You can also send your questions in the chat box. We will conduct the Q&A after all three speakers have presented. We do have a very short survey we are asking that everyone complete after the webinar. The survey will appear in your browser once the webinar ends, but it will also be emailed to everyone who attends today. This survey helps us to know your thoughts on this webinar and topics you would like us to consider in the future. As you all know, November 11th was Veterans Day. We would like to thank all of our veterans for their service. The goal of today's webinar is to discuss some of the programs, services, and benefits available to veterans with ALS. The speakers today are from the VA, Paralyzed Veterans of America, and Maxim Healthcare Services. I'd like to start by introducing our first speaker, Michelle Carpin, who will be discussing programs and services through the VA. Michelle serves as the Erie VA Medical Center's Spinal Cord Injury and Disorders Coordinator. Michelle has worked at the Erie VA for more than 16 years. She attended Edinburgh University of Pennsylvania, where she received her Bachelor's of Science degree in Health Education, and where she completed her Master's of Social Work degree in 2008. Shortly after her graduation, Michelle was hired at the Erie VA as an inpatient social worker for acute care and ICU. In addition to inpatient social work, Michelle has also worked in the outpatient clinics, in health promotion, disease prevention, and in caregiver support. She began her role as the Erie VA's Spinal Cord Injuries and Disorders Coordinator in 2022 and provides care coordination and case management services to veterans with paraplegia, tetraplegia, multiple sclerosis, and ALS. She describes her work with our nation's heroes as an honor and a privilege, and in her spare time, Michelle enjoys teaching as an adjunct lecturer at Mercyhurst University in Pennsylvania. So I'm going to start the webinar by handing it off to Michelle. I believe you're muted, Michelle.
Okay, let's try that again. Thank you. Thank you everyone for being here. Thank you for allowing me this time to spend with you today. To the veterans on this call, thank you for your service. To the caregivers on this webinar, I'd like to wish you a happy National Family Caregiver Month. And would like to take this opportunity to thank you all for everything that you all do in caring for our nation's heroes. As I'm aware that there may be some participants from various areas on the call today, I wanted to give a little context to where I'm speaking to you from. I work at a small facility in northwestern Pennsylvania, Envision 4, which covers Pennsylvania and part of Delaware. We serve about 23,000 veterans at the Erie VA amongst our 5 community-based outpatient clinics. Most of our catchment area is largely rural. We are a 5-star facility in Erie with foundational services in acute medicine, urgent care, primary care, behavioral health, and we have a community living center. As you can see, the United States is divided into various regions and VISNs. So we'll be talking a little bit more about that here shortly. So we are all here to talk about ALS within the veteran population. Did you know that military veterans are more likely to be diagnosed with ALS than the general population? Researchers don't know yet why this is the case, but the numbers are pretty staggering. Veterans are almost 2 times more likely to develop ALS than the general population, regardless of era or location of military service. More than 16% of individuals with ALS are veterans. Considering the prevalence of ALS among the veteran population, VA has made advances in the care and treatment of veterans with ALS. In 2006, an Institute of Medicine study concluded suggestive evidence of the association between military service and ALS. Again, researchers do not know the correlation, yet it does exist. In 2008, VA was designated as VA designated ALS as a disease that is presumed to be connected to military service for those serving more than 90 days of continuously active service. In 2009, Chief of Patient Care Services within VA charged a national task group to develop comprehensive services for veterans based on national best practices. In 2012, VA amended its disability rating to assign a 100% service-connected disability evaluation for any veteran who has service-connected ALS. As you can see, things continue to evolve with regard to ALS within the veteran population. Out of that 2009 task force came VHA policy, which has continued to change and is as more is learned about the development and treatment of ALS. It is VHA policy that all eligible veterans diagnosed with ALS have access to a full spectrum of clinically appropriate interdisciplinary primary and specialty care throughout their lives and throughout the process of the disease. The focus on clinical care is providing optimal quality of life through management of symptoms. The ALS system of care consists of at least one regional ALS interdisciplinary team in each VISN, the map that we showed a few moments ago, that are tasked with addressing the complex medical, physical, functional, psychological, and social effects of ALS. Efforts are underway to enhance teleneurology services to provide more comprehensive care to veterans, even in rural populations. The complex needs of veterans with ALS are best addressed through a single point of contact, such as a neurologist provider or an experienced VA medical facility ALS coordinator. Here on the screen, there is a link that I can drop in the chat when we're done here, or when I'm finished presenting today, that has a list of VA ALS services. So it's divided between ALS Centers of Excellence, ALS interdisciplinary teams, or ALS points of contact. Every facility does have an ALS coordinator. Various facilities meet the needs of ALS veterans in different ways. As I mentioned, some have clinics, some utilize telehealth services, and some utilize community care. Sorry about that. One thing remains consistent, though, is the designation of an ALS coordinator to help veterans and family members be able to navigate VA systems and community systems in the treatment of ALS. Interdisciplinary members of the treatment team assess and provide interventions to address issues relating to some of the things listed here on this slide. So some of those things may include mobility evaluations, looking at self-care needs if the veteran is able to meet those needs on their own or if they need additional assistance, looking at speech and communication, swallowing, nutrition and hydration, assessing memory changes and changes in cognition, drooling, lability issues relating to uncontrolled laughter or crying, for example, breathing problems, energy expenditure for activities of daily living, pain management, mental health. ALS treatment considerations also involve preparing for future medical decisions. What interventions might a veteran with ALS want or not want? Risks and benefits of medications, genetic testing and counseling, research and clinical trials. The list could be pretty exhaustive and continue to go on, but these are some of the big things that the ALS interdisciplinary team would be looking at and addressing. So going back to the ALS coordinator role, as I mentioned, this coordinator role exists in all VA medical facilities, regardless of whether or not there is an ALS interdisciplinary clinic. For example, our facility here in Erie, it is a smaller facility. We do not have an ALS clinic, but we do have an interdisciplinary team. We utilize neurology services via telehealth or community care. The ALS coordinator serves as point of contact for veterans with ALS and their caregivers. The ALS coordinator generally performs an initial needs assessment to address medical equipment needs, availability of community resources, caregiver services, looking at burden and strain for the caregivers as well. The ALS coordinator coordinates with facility departments internally and externally to make sure that items that are needed are provided and getting services into place that are needed. They arrange appointments for interdisciplinary care and do just kind of a whole host of other things, including providing education, resources, tools, support, self-management strategies, just kind of being that person for the veteran and their family throughout the continuity, throughout their care of ALS. So with that said, as an ALS coordinator here at the Erie VA, I was trying to kind of whittle down what information I thought was most important in terms of this particular presentation. I could probably be here all afternoon providing lots of information. This certainly is not a comprehensive discussion, but it's kind of consists of the things that I find to be most important throughout the disease process of ALS. With that being said, we're going to talk about financial benefits, housing, auto, home and community-based services, and caregiver support. The one thing I will mention is some of these slides, I may not go into significant detail because I believe that they may be covered in the other presentations today. So in terms of disability compensation, this is kind of one of the things that aside from getting a veteran enrolled in VA care if they're not already enrolled, this is really a top priority, at least for me, in terms of helping the veteran get connected. VA disability compensation is also known as service-connected disability, and this offers a monthly tax-free payment to veterans who become sick or who were injured while serving in the military, and to veterans whose service time may have made an existing condition worse. ALS is a presumptive service-connected disability for veterans who have served at least 90 days on active duty. So we kind of touched upon this in the slide that had the timeline in terms of ALS is presumed to have been related to military time if a veteran did serve and served at least 90 days. Over the years, as I mentioned, things have evolved over the years within VA in terms of care provision and services and benefits. ALS is now rated at 100% service-connected disability for veterans who do have ALS. There is the potential for veterans to have additional payments called special monthly compensation, and the PVA presentation here in a few moments will be just covering a little bit more about that. So bottom line is when a veteran at least comes to me who is newly diagnosed with ALS, once they have that enrollment within VA, I'm really working really hard with service officers to help them get service-connected disability. Thankfully, it's been a pretty quick process with the help of some of our amazing service reps that we have in the community, PVA being one of them. But veterans are able to use any service organization that they wish, or they can even file on their own. But I do encourage folks to use a reputable service organization when filing claims for benefits, particularly service-connected disability for ALS. We also just really strongly encourage veterans to keep us abreast of changes so that we can continue to monitor them and collaborate as needed regarding their disease progression so that we can help them get connected with special monthly compensation if their condition progresses to the point of loss of use, for example. So next, we're going to talk about home and auto grants. We will touch upon veteran readiness and employment independent living grant, specially adaptive housing grant, HISA grant, and the auto grant. So the latter three I will just briefly talk about because, again, they'll be reviewed in the next presentation. So the Veteran Readiness and Employment Program offers a range of services to assist veterans with increasing independence with activities of daily living through an independent living track. There are several other tracks that are related more to employment, but the independent living track offers a grant that is intended to help individuals who require assistance to improve independence at home. So that improvement of independence at home may involve home adaptations that are part of an approved rehabilitation plan. So this grant is not particularly just for veterans with ALS, veterans who are service-connected at 20% service-connected disability rating and have a need for adaptations related directly to their service-connected disability may be eligible to apply for the VRE Independent Living Grant. But it does offer around $107,000 to help with home modifications. This grant seems to not be very well known about. It is gaining a lot more popularity within the ALS population in terms of using this grant and other ones that we'll talk about today as well. But it is really intended to make the home as modified so that the veteran can have as much independence as possible. So it may be one of the big things with this grant is kind of looking at want versus need. So it can't be used for general remodeling, for home maintenance, for pools or fencing or things like that. But it really does have to do with what the veteran actually needs to be as independent as possible at home. So the Specially Adaptive Housing Grant, or the SAH grant, the goal of this grant is to provide eligible veterans and service members who have severe, permanent, and total service-connected disabilities with a barrier-free environment. ALS is the only presumptive diagnosis for SAH, meaning that veterans who have ALS are generally assumed to be entitled to this grant. So I won't go any further into detail on this one. There's information here on the slide, but it will be addressed further here in a few moments. Next is the HISA grant. This stands for Home Improvement Structural Alterations, and this provides a much smaller amount, around $6,800 for veterans who are 100% service connected, rated at that rating. And it is for providing necessary home improvements to treat or allow for disability access. So this will also be addressed in the next presentation. And then finally, the Auto and Special Adaptive Equipment Grant. So this is also, it may be for veterans who have other ailments in addition to ALS, but a veteran diagnosed with ALS is automatically entitled to a certificate of eligibility for financial assistance in the purchase of an automobile that is adapted to meet their needs. So I am going to defer further conversation to the PBA on this one as well. So that brings us to programs and services through the VA. So these, all of these programs that I'm going to talk about are programs that may be available to veterans who don't have ALS based upon their clinical need. But they are all things that I have seen used, highly utilized within the ALS population. So we'll be discussing the Homemaker Home Health Aid Program, respite services, adult day healthcare services, and home-based primary care. So all of these programs are kind of under an umbrella of services called geriatrics and extended care. These programs may be used in conjunction with one another, and they are based upon clinical need, and availability may vary by location. VA has many facilities across the country, and some services may be available in some locations and may not be available in other locations, and services are also dependent on availability of community agencies as well for some of the programs. But all enrolled veterans are eligible if they meet the clinical need for the service. Some veterans may be charged a copay based upon their service-connected disability status. It's also called their priority group, which takes into account their service connection as well as their financial information. So veterans with ALS who are rated at 100% would not have any copays or any out-of-pocket expense for any of these programs. Veterans who are copay required may have a copay between $15 and $50 per day, depending on the discipline. So we'll get into a little bit more of that here shortly. So some services are, actually all of these services are provided in the home with the exception of respite, which may be provided in center, which is with the $97 per day copay may yield if the veteran is in a certain priority group, but again, would not apply to ALS veterans who are service connected at 100%. Okay, so we'll start with talking about the Homemaker Home Health Aid Program. This program offers personal care assistance in providing in-home supportive care that enables veterans who are frail or disabled to live safely in their communities. There is a big push within VA, and I think in the community as well, to age in place. So most folks want to stay in their homes as long as they possibly can do so safely. So some of these services are intended to kind of help with that aging in place. Homemaker Home Health Aid Program services offer trained aides that come to the veteran's home to help them meet their daily needs and complete their activities of daily living. Generally speaking, Homemaker Home Health Aid services are provided by contracted agencies, and they are intended for, again, those who need personal care assistance. It may be helpful for veterans who are isolated, who maybe have caregivers that may be experiencing some burnout or just being generally overwhelmed with the care of the patient. And as with all of these services, service provision is based upon clinical need and may vary by location. So you'll be hearing from one of the agencies that is contracted to provide Homemaker Home Health Aid services, among others, here later on today. Okay. So next, we're going to talk about respite services. Respite consists of personal care services to provide relief for the caregivers of veterans with chronic illnesses, again, to kind of support that concept of aging in place. Respite services are intended for those who need help with activities of daily living and who are reliant on a caregiver. So respite care is a program that pays for a short period of time for family caregivers who maybe need a break, maybe they need to run errands, maybe they just want to go get their hair done. It is intended to allow for an aide to come into the home and be with the veteran to keep them safe and provide personal care assistance while the caregiver is away. There are two types of respite. There's in-home respite care, which is provided by agencies, and then there's nursing home respite care, which would allow for a veteran who may need to have extended care in a facility while their caregiver, for example, is having surgery or going to be out of town. I'm currently working on a couple of in-center respite requests at the moment. I just got off the phone with a caregiver who's going to have carpal tunnel surgery, so she needs to have her veteran cared for inpatient while she's having her surgery and recovering. So that is one use of respite services. For folks who are going to utilize the in-home respite, there's a maximum of 30 days per calendar year for as a cap for respite services. Some may choose to use them in smaller increments, such as for 1-week episodes of care. Generally, as with all of these services, provision of services is based upon clinical need and may vary by location, generally intended to be for veterans who require nursing home level of care. Okay. Next, we have adult day healthcare services. These services provide therapeutic services in a congregate non-institutional setting. It's basically a day program that offers social support, peer support, companionship, recreation. We often offer a noontime meal. Some facilities or locations are able to provide personal care assistance, like giving the veteran a bath or a shower while they're at their adult day health service center. Again, same thing, intended for veterans who require assistance with ADLs. Some of the services that may be provided may include services from nurses, social workers, recreation therapists, etc. Adult day programs often have half-day options or full-day options, and many veterans utilize those services multiple times a week. Unfortunately, a theme that we've been noticing here in Northwestern Pennsylvania, we used to have 2 adult day healthcare services in our catchment area, and unfortunately, COVID negatively impacted them. So currently, our facility does not have any contracts for adult day healthcare. So that may be the case in other areas as well. It's a really nice program, though I really miss it. We had a lot of veterans who really, really enjoyed going to those centers. Okay, so next we're going to talk about home-based primary care. I may use acronyms, and I apologize if I've already used many acronyms here. It just becomes kind of rote. But home-based primary care, we also call it HBPC. It is a program that provides healthcare services to the veteran right in their home. So their primary care is received in the home versus coming to the hospital, for example, to receive their primary care. It is intended for folks who require in-home support, who have, severe diseases or illnesses that affect their ability to get out of the home and affect their activities of daily living. It provides a comprehensive team, interdisciplinary team of folks who provide assistance. So there is a nurse practitioner, a physician, or a physician assistant who is the primary care provider. They provide their annual or semi-annual visits right in the home. There is a nurse who has more frequent visits, typically, at least the way our program operates here in Erie. Our nurses usually go in once to twice a month. They can do things like fill the pill box, they'll assess the veteran's skin integrity, provide education and support. Social work is involved, rehab such as physical and occupational therapy, psychology, nutrition, pharmacy. So those are some of the main disciplines that are involved in the home-based primary care program. Next, we have medical foster home. This program can serve as an alternative to nursing home care and is appropriate for veterans who require nursing home level of care, but may not want to receive that care in a nursing home. So they may prefer more of a home-like non-institutional setting with fewer residents. This is provided in private homes in which trained caregivers provide services and provide 24/7 care and supervision. The caregiver is able to help with things like activities of daily living, such as bathing, getting dressed, feeding, those kinds of things. Veterans who are in the medical foster home program also receive home-based primary care that we just spoke of. This is a program that is relatively new, at least at our facility. It's been around for a long time and in other locations. We are still working. We've had our coordinator for probably almost a year and a half, and she's still working hard to be able to locate a foster home that is able to start taking on residents here in Erie. But there are, I know just across the state line in Ohio, there is a medical foster home, and through the Cleveland VA, I know various other locations have medical foster homes. It seems like a really nice program. Hopefully, once it gets up and running in all locations, it'll be really useful for folks. Next, we're going to talk about the Veteran Directed Care, or the VDC program. This is another program, at least here in our location, is relatively new. We just hired a coordinator on a few months ago. But this Veteran Directed Care program gives veterans the opportunity to receive services in a consumer-directed way. It is intended for those who require a high level of personal care services and help with activities of daily living. May be targeted more for people who have frequent inpatient hospitalizations, but ultimately those who have the desire and are able to provide more control over their services and supports. The veteran must require a nursing home level of care as supported by a standardized assessment. So they have to have a clinical need for the program. Essentially, veterans are given a budget for services that is managed by the veteran or the veteran's representative. With the help of a counselor, veterans are able to hire their own workers to meet their daily needs to help them live at home or in the community. So again, the concept of aging in place is fully supported by the Veteran Directed Care program. And as with all of them, services may vary by location. Not every facility has this program up and running yet. It's kind of, I think, a staged rollout. All right, so moving on to talk about Community Living Center. We also call that CLC, or Contract Nursing Home. So Community Living Center is a VA nursing home. It's a place where veterans may come for short-term rehabilitation or for veterans who really need longer-term care and may choose to live out the end of their life at the CLC. The CLC provides nursing home level of care, which helps with activities of daily living, skilled nursing, medical care. Across the country, there are over 100 locations of the CLC. We have one here in Erie. There are many locations do have Community Living Center, but it's intended to provide a home-like environment for our veterans. Eligibility for CLC is based upon priority group. Copays may be assessed depending on service connection, level of disability, and income. I did put up here contract nursing home, but I guess I did not really address that. We do have many veterans who do need nursing home level of care, and we may not have an opening available at our CLC for them to come and live here or to be here for short-term rehab. If that is the case, we often may offer them contract nursing home placement, in which we contract with various nursing homes in the community to provide the care if we cannot provide it ourselves here at the VA. So that is what contract nursing home is. So the next couple of slides are skilled care services. So these are services that are not necessarily unique to VA, but they are services that many patients in the community may require, after a hospitalization, if they have wound care concerns, if they're debilitated and need therapy. But skilled care services are provided by qualified personnel that include assessment, treatment planning, treatment provision, patient and family education, health status monitoring, reassessment, referral, and follow-up. So generally speaking, most skilled care services may be nursing, physical therapy, OT, social work services, or speech therapy. Some of those services are not standalone. For example, occupational therapy cannot be provided as a standalone service. It would need to be bundled with another service such as nursing or physical therapy. Same with social work services and speech therapy, I believe. These services may be provided under a veteran's private insurance, Medicare benefit, or VA may cover skilled care services as well, just depending on the situation. And then palliative care and hospice, again, not unique to VA system, but certainly services that are often utilized. Kind of the same parameters may apply depending on the situation, whether or not a veteran's private insurance is utilized or if it's paid for by VA. But palliative care and hospice. So palliative care is actually both services, palliative care and hospice, should be an early consideration of the management of ALS, of all ALS veterans. But palliative care provides comfort care that focuses on relieving symptoms and suffering so that the veteran may continue to really do what matters most to them. Palliative care provides interdisciplinary care, again, aimed at improving quality of life. Palliative care may be used in combination with other treatments that are aimed at curing or controlling disease processes, whereas hospice is the primary goal of hospice treatment is comfort rather than cure, and it is for veterans or patients rather with advanced disease processes that are life limiting. Comprehensive hospice services do utilize the same interdisciplinary team of professionals and may also be staffed by volunteers. Hospice care can be provided at a VA facility, contract nursing home, or possibly at home as well, depending on the resources available to the patient. Okay, so those are all of the services available that really are definitely aimed toward the veteran, but may provide ancillary support to the caregivers. But I wanted to, before I wrapped up today, to talk a little bit about the caregiver support program. So caregiver support offers clinical services to the caregivers of eligible and covered veterans who are enrolled in VA healthcare system. The mission is to promote the health and well-being of family caregivers who care for our nation's veterans by providing education, resources, and support. So the caregiver support program at the VA offers two kind of sub-programs. One is called the Comprehensive Assistance for Family Caregivers Program, and the other is a program of general caregiver support services. So I'm first going to talk about the PCAFC, or the Program of Comprehensive Assistance for Family Caregivers. So that program offers enhanced clinical support for caregivers of eligible veterans who have a serious illness or injury and require in-person personal care services, among other requirements. Veterans and caregivers who are in receipt of this program may receive education and training, access to healthcare insurance, mental health counseling for the caregiver, a financial stipend, enhanced respite, so respite beyond what may be provided through the general benefits package, travel and per diem compensation, financial planning, and legal services. So in order to be eligible for the PCAFC program, a veteran must have a single or combined service-connected rating of 70% or more. So veterans who have ALS would be eligible to apply for the program, and depending on their level of need, may be eligible to get into the program. The veteran must require personal care assistance for a minimum of six continuous months based upon inability to perform activities of daily living, the need for supervision or protection, or the need for regular and extensive instruction or supervision, without which the ability of the veteran to function in daily life would be seriously impaired. So there are some other things that go into determinations for entry into the program. The veteran must receive care at home. It must be in their best interest to participate. The personal care services will not kind of overlap or be provided simultaneously by another individual or entity. And they must be enrolled in VA healthcare and also receiving their primary care from a VA healthcare team. Determinations for PCFC, there's an application process. Ultimately, there's various assessments that take place by various clinicians, and the final determination is made by a centralized team, typically through the VISN, that is called the Centralized Eligibility and Appeals Team. So they kind of look at all of the different assessments and perspectives, and they make a determination of entry into the program. And then the program of general caregiver support services. This does not have requirements in terms of service connection. This is for any caregiver, even if they're caring for a veteran that they are not able to be into the PCFC stipend program, just caregivers that need support. So veterans must be receiving care from a caregiver. They must still require assistance with activities of daily living or need supervision and protection. But PGCSS is one of the acronyms we use for this program, offers peer support mentoring, skills training, coaching, telephone support, and online programs. This program is really nice, even if a veteran may, for example, I have one veteran with ALS. He was diagnosed in February. He's still pretty independent. He's having some issues with loss of use of finger dexterity, but he's still largely able to complete his own personal care, is able to still kind of get out and get on the lawnmower on days that he wants to, that he's feeling well. At this point, he would not be I would not anticipate that he would get into the stipend PCAFC program, but his caregiver would still be eligible for general support services right now. Now, as his condition progresses, I again really encourage them to stay in close touch with me so that I can know about changes as they're happening, so that I can, at the most opportune time, get them connected with PCAFC or any of these other programs and services that are available. There is a caregiver support line there listed, toll-free number. I don't think it's a 24/7 number, but it is offered most days of the week during, I think, up until like 6 o'clock. But it is a nice resource if people just want to learn a little bit more about PGCSS or PCFC. It's available there as well. Okay, so I threw a lot of information out there at you. I listed all of the resources that were utilized in development of this program or this discussion here today. There are some directives that are referenced here. There is a really, really nice video. It's only a 3-minute video. I will drop the link in the chat if anyone cares to retain it for future use and to take a look at. But it kind of encompasses many of the things that we talked about today and probably a lot more as well. I thank you very much all for your time. Thank you so much for allowing me to be here today. Thank you.
Thank you, Michelle, for that wonderful presentation. And I can also share links to anything that you were not able to, or that you wanted me to share with anybody in attendance. But that was such great information was included there. And Michelle will join us again at the end to answer any questions you may have for her. I saw a couple questions in the chat. You know, we might answer some questions as we go in the chat as well. So keep an eye on that if you put a question in there. Our next speakers are Justin Platt and Marissa Sabatucci, who are here as representatives from the Paralyzed Veterans of America. Marissa and Justin have been with Paralyzed Veterans of America for 2 years. Together, they make up the Pittsburgh Service Office, which is a part of the Benefits Department of PVA. The PVA Veterans Benefit Department provides free assistance and representation to PVA members and other veterans seeking the health care and monetary benefits for which they are eligible. Membership eligibility to PVA includes veterans with spinal cord injuries and diseases such as ALS. Justin and Marissa specialize in claims involving loss of use of extremities as well as ALS claims. So I will hand it off to Justin and Marissa now.
All right, thank you. Can you see my screen okay?
Yes, we can.
Perfect. Well, thank you for having us. We're really excited to be here. So yes, we are the Pittsburgh Service Office. Like Ryan said, my name is Marissa Sabatucci, and I'm the administrative assistant here at the Pittsburgh Service Office of PVA.
I'm Justin, the National Service Officer.
So a little bit about who we are. Paralyzed Veterans of America is a congressionally chartered veteran service organization. We were founded in 1946 by World War II veterans who came home with spinal cord injuries and found that there were many barriers to their independence and not a lot of resources to help them with improving accessibility and, reclaiming that independence. So we do have a unique experience on a wide variety of issues involving the special needs of veterans with spinal cord injuries and diseases, and that includes ALS. So we help veterans with ALS quickly access resources like healthcare, medical equipment, and different monetary benefits that the VA has to offer to help improve the quality of life of our veterans. And like Michelle was touching on, that includes different grants like the automobile grant, the special adaptive housing grant, and all of that we'll discuss a little bit later in the presentation. I also just wanted to note that we are the only nonprofit veteran service organization dedicated solely to helping veterans with spinal cord injuries, disorders, and diseases. So that also includes ALS and MS, among other things. So while we are the benefits department, we primarily work as advocates before the VA benefits department. PVA also offers a variety of other resources that benefit every aspect of a veteran's life. So here are just some examples. We have opportunities for membership, which we're going to talk about a little bit later on. And then the rest of this, we're not going to really touch on too much besides this slide. So I did have a QR code that you can scan the link, and I'll also drop the links that we do in the chat after the presentation if you want to click on those. But we also have an on-staff legal team that helps represent veterans pro bono before the Board of Veterans Appeals. We have in-house architects that consult on making private and public spaces more accessible. We advocate for legislation to improve accessibility, and we support research into spinal cord injuries and diseases. So like I said, the link, the QR code, or I'll drop it in the chat if you want to learn anything more about the other departments of PVA. And I'm handing it over to Justin for this one.
All right, so we mentioned VSO and a veteran service organization. So what is a veteran service organization like PVA? We are accredited by the VA. That means all staff members like administrative assistants and national service officers like myself and Marissa go through extensive training to learn all the legal mumbo jumbo that none of us want to even talk about right now. It gives everybody a headache. Understanding the laws, the Code of Federal Regulations that dictate how the VA must act and how they must rate things. And it's our job to really act on your behalf in front of the VA on all of your concerns and interests. And that Marissa has already mentioned, all services provided by PVA are always free. You don't always have to use PVA if you have ALS. I want to put that out there. If you have a VSO you're working with, you like your national service officer, happy. If they have questions about anything to do with ALS, SMC, we will talk to them and help them through the process as well. We have the other major VSOs for the area in our building, such as VFW, DAV, and they regularly come and ask us questions when it comes to ALS, SMC, and other SCI related questions. And you can always check your VSO's accreditation at the link provided. This accreditation is through the Office of Inspector General at the VA. They take this very seriously. And whoever you work with, I would make sure they're accredited. Next slide, please. So Michelle briefly touched on this earlier when we talk about eligibility for VA benefits, and it really comes down to what the VA considers a veteran for their purposes for compensation and benefits. And it was briefly touched on the 90 days or more of continuous active duty service. And this is really complicated for some of our service members, especially National Guardsmen and reservists who don't have active duty times. We're going to use big air quotes here, because the VA has time that they consider to be other than active duty for training. And so reservists, National Guardmen, when you join, you go through basic training, your job school. They don't count that time as active duty time necessarily. There are some cases and specific situations and scenarios where that could satisfy the criteria. If you have individual questions, please reach out. We can go down this rabbit hole till next week. But briefly speaking, if you're reservists or National Guards, if you had full-time duty in the reserves, such as ADOS orders, overseas deployments, mobilizations to different states as part of the National Guard, that is generally what the VA will consider other than active duty for training for those branches. Generally, the weekend drill and annual trainings, the VA unfortunately does not consider that time to be active duty service. And then receive any discharge other than dishonorable. So that's the two basic pieces of criteria needed to establish compensation and most benefits with the VA. Next slide, please. Michelle also mentioned that ALS is a presumptive condition. And what that means is that the VA has ceded that military service in and of itself. And ALS is unique in this, that it is independent of when and where you served. Military service, regardless if you never left, the States, or you went overseas, or if you were in a period of war or out of a period of war, it is just service in the military. Has some sort of connection. What that is, I don't know, but the VA has conceded that grants a 100% service-connected disability, and that is permanent and total, 100%. That stays with you, puts you in priority group 1 for all VA benefits, which Michelle touched on earlier with co-pays. And due to the nature of ALS, this is actually very important. If your claims officer, or your representative rather, knows how to file claims properly for ALS, these claims are directed to be adjudicated extremely fast. I'm not going to put my foot in my mouth and give you any days, but some turnarounds that would make your head spin for government work. Next slide, please. And as Michelle so greatly went into depth, VA healthcare is a big big benefit to all of our ALS veterans, that copay free access to healthcare being priority one. Prescriptions. I'm not sure if Michelle had mentioned it, but once you're 100% service connected for any disabilities, you also get dental care through the VA. But not every veteran gets that. You have to be 100%. So I just thought I'd put that out there. We just touched on ALS granting that 100%. And then you travel pay reimbursement for VA appointments. There's a per diem that changes annually. It's a percentage per mile. It's fun. It's the VA pays you for coming to appointments, or at least compensates you back your gas money. And then she also talked about those fantastic ALS teams we have at all of our visits. Next slide, please.
Okay, so in addition to the healthcare, we also deal with VA compensation, and ALS Service Connection will entitle you to VA compensation. And disability compensation is a monthly tax-free payment to veterans. And like we said, ALS is an automatic 100%. So as of right now, this is going to change at the end of the year, but for 2024, the 100% rate for a single veteran is $3,737.85. And then there is additional compensation available depending on how many dependents you have. Oh, you're muted, Justin.
There's special monthly compensation that is paid in substitution to the 100% disability. It's a much higher amount of compensation, and it's needs based. So every single case is different. You know how we say ALS is the 100%. We have that exact dollar amount to give you. With SMC, it's progressive. It's each individual person. We look at loss of use. If your hands, if you're unable to grasp, if you're unable to walk and you're in a wheeled mobility device, if you need help with eating, dressing, bathing, for aid and attendant, loss of a creative organ, and severity of other disabilities that you might otherwise be compensated for do entitle you to higher amounts of compensation. This is a very complicated subject. Most employees in the VA struggle with it. And this is where a lot of other VSOs reach out to PVA for our help and assistance, because this is where the majority of our training takes place, is on SMC. So, next slide, please.
All right, and so then in addition to the healthcare and the compensation, there are many additional benefits that the VA offers you with your ALS Service Connection. So it's important to note with all of these benefits, there are different eligibility avenues that you can go down. But since we're dealing with ALS today, all of these are granted automatically once you get that ALS Service Connection. So we have the automobile grant, and that comes with the adaptive equipment reimbursement. And these are both used to buy an adaptive vehicle to fit your accessibility needs. And we're going to talk about that a little bit later on as well. And then there are also several different disability housing grants, all with different eligibility requirements, depending on if you own your home or you're living with family member or you rent, and also dependent on whether you're living in a temporary or permanent residence. And we mostly deal with the SAH and the HISA grant. So that's going to be what we touch on the most. But again, with anything that we talk about, if you have any specific questions, feel free to reach out about them to us. And then there are also benefits for your dependents as well. So unfortunately, one of the main concerns that we get for our veterans is whether their family is going to be taken care of when they're diagnosed with ALS. So we're going to talk a little bit about what the VA offers for your dependents and survivors as well in a few slides. So starting off with the automobile grant, this is, again, a monetary allowance for the purchase of an automobile. Right now in 2024, the current rate is $26,417.20. And this used to be a one-time monetary allowance, but since the passing of the Auto for Veterans Act last year, this is going to be able to be used multiple times in an eligible veteran's lifetime. They're rolling it out in phases, but eventually in 2033, it will be available every 10 years to a veteran. So with the auto grant, the VA also pays reimbursements for adaptive equipment to be installed in your vehicle. So these adaptations are going to need to be prescribed based on your needs. So typically, your primary care physician with the VA will place a consult to prosthetics, who will evaluate your needs through the driver's rehab program. So referred veterans to the driver's rehab program will work closely with drivers training professionals, and that includes occupational therapists, physical therapists, people like that, at one of the 50 facilities nationwide. And they're going to be offered behind the wheel training, equipment recommendations, and even assistance at their DMV of their state to help obtain a valid license for the adaptations that they're using. And we did want to note that these adaptations can include those to operate a vehicle, so like hand controls, or just ingress and egress, so to enter and exit your vehicle like a ramp. So you don't have to be able to drive your car in order to go through the driver's rehab program and get these adaptations.
All right, and then on to specially adapted housing. So this is probably the most, I won't say the most, one of the more expansive grants available to veterans that have, typically veterans that have a loss of use of hand or foot, but in this case, it is granted to ALS veterans as well. And this grant is, this year, plan to go up, is at $117,000. And this can be used up to 6 different times for major projects in your house. We're talking hallway widening, ramps, making a bathroom more accessible where you can actually like get a chair in and have rails help you assist to a toilet. These are much larger in scope projects. And as I said, you can use this up to 6 times, up to that total amount, whatever it currently is. Currently $117,000 and $117,000. At 14 can cover some taxes. Now, when you use SAH or specially adapted housing, you get the opportunity to enroll in Veterans Mortgage Life Insurance, and this is a very important benefit to those when we ask about what benefits and try to lessen the burdens we leave for our families. And what this mortgage life insurance does, as long as you enroll and construction starts before you turn 70, they will pay up to $200,000 of the remaining balance of your mortgage as a life insurance policy, which helps families out a lot. That's one less thing to leave your spouses with. Next slide, please. Oh, and Melissa is going to talk about the HISA grant now. You're muted.
The one time I mute my mic. Okay, so compared to the SAH grant, the HISA grant is a little bit smaller, but it stands for the Home Improvements and Structural Alterations Grant. And it's just another grant you can use to modify your home. And you can use them both. So this grant will need to be prescribed based on your needs by a VA physician, and it's going to pay for adaptations made to your permanent home. But unlike the SAH grant, you do not need to own the home. If you're a renter, you just need a signed and notarized statement from the owner authorizing those improvements. So alterations for the HISA grant can improve making your home entrances more accessible, improving accessibility in your bathroom, and improving like your plumbing or your electrical systems to sustain durable medical equipment you may need. It will not pay for things like walkways to exterior buildings, spa, hot tub, or jacuzzi, kind of what Michelle was touching on. It's needs-based, not wants, so you kind of have to suss out the difference between the two. And all veterans with ALS are going to receive the $6,800 from this grant. That's the current rate right now. But please note that eligibility requirements for this vary. So some veterans are only going to receive $2,000 from the HISA grant, but for ALS Service Connection, all veterans will receive that $6,800.
Just one more general thing to put out with both of these grants is while VA is quick to grant these grants, the actual process of getting a contractor, getting them certified, all the paperwork done, and breaking ground can take some time. So it's highly encouraged with these grants that with the onset and the diagnosis and the service connection, start putting that process towards the front burner so you're not trying to get it done later down the road. And so with that, we're going to touch some more on what's available to the families. Big question that is always asked is what's available for my kids, what's available for my spouse. And there are some things that are offered immediately upon being granted the 100% service connection for ALS. We will be granted Chapter 35 or DEA, which is and works as a sort of GI Bill that's available for your spouse and your children. And I want to double check my dates, but I believe going forward from last year, there is no time limit on the expiration of those for your spouse or your children to utilize those benefits. And it helps cover the cost of some college and on-the-job training. And just for the general, put it out there, students will contact or work with their Veterans Affairs office in their college, tell them what they're doing, and they'll know what paperwork to file. So then this one is never easy to discuss. There is dependency and indemnity compensation is available to surviving spouses, surviving families if children are minors. And if you were to pass away from a service-connected injury or illness, they continue to receive a tax-free payment, similar to VA compensation payments on the first of the month. But this is at a fixed amount, regardless of any previously established SMC or service connection. And that's $1,612.75 for this year. And then additionally, there is a myriad of memorial benefits available through the VA. We can get flags, urns, internments at national cemeteries. That's all done through the VA, different paperwork to file there. And then there's the burial grant. Right now for service-connected deaths, the burial grant is at $2,000, and that's to help offset some of those funeral costs.
All right. And lastly, we mentioned this a little bit earlier, but PVA membership. So we put the eligibility requirements on the screen, but if you're eligible for ALS service connection, you're going to be eligible for PVA membership, most likely. So the chapter and the chapters, we have many chapters across the United States. There's 34 PVA chapters. They're not directly affiliated with our office, but we do work closely with them. So PVA membership is similar to like a DAV or a VFW membership in that it's a fraternal organization. So it's a great way to meet fellow veterans with spinal cord injuries and diseases for a sense of support and community. They have outings, support groups, events, things like that. And it's, like I said, we have 34 chapters nationally, and local chapters around us in the Pittsburgh office include the Keystone chapter, which is the Pittsburgh chapter, the Colonial chapter, which is in between Baltimore and Philadelphia, the Buckeye chapter, which is in Northeast Ohio, and the self-explanatory New England chapter. But like I said, 34 chapters, so there should be one near you, and you don't have to live near a chapter to join it. So if for whatever reason you like a chapter further away from you better, that's no problem. And so I did just want to make this distinction that you don't need to apply for membership to use our VSO services. And similarly, you don't need to appoint us as your representative if you want to join a local chapter. So for example, if you already have a VSO you really like, they do good work for you, joining a local chapter might be a great way to get involved with PVA without appointing us as your representative for VA benefits. And I did just want to throw in here as well that we have 73 national service offices nationwide. So there should be one close to you. And we're going to, in the next slide, show you how you can find your local chapter. But if you do want to apply for membership, like I said, there's a QR code. Here's the link, or I'll drop it in the chat after the presentation. And lastly, here is our contact information again, if you want to reach out to our office. If you are not near Pittsburgh and you want to find out which office is closest to you, you can call the number on the screen for our national benefits hotline, and they will be able to direct you to whatever office is closest to you. And that is it for us. Unless you have anything else to add, Justin.
Nope.
Okay.
Again, I just want to touch on membership. Even if you don't want, you're happy with your representative. They're a great group of people. The support groups are there for the ALS, MS, and other specific diseases. They just got together a couple months ago and all went out to Kennywood, and they do some fun stuff.
Well, thank you, Justin and Marissa, for all the great information. And again, Justin and Marissa will be here at the end of the webinar to answer questions that you have submitted. But I'd like to introduce our final speaker of the afternoon, and her name is Danielle Armbruster, and she is the Regional Director for Military and Federal Home Care at Maxim Healthcare Services. Danielle has been with Maxim for 14 years. Maxim is a national provider of home health care and is a community care network provider for veterans in 42 states. In 2023, Maxim cared for over 1,500 veterans with a diagnosis of ALS. Maxim specializes in one-on-one in-home nursing care to keep families together at home. And so I will hand that off to Danielle to discuss their programs and services.
Thank you, Ryan, for the opportunity to speak on this call. And just want to echo the gratitude that was already said by the presenters before me. I also want to say thank you for your service to all the veterans and veteran family members on this call. It's my true honor to be able to assist our nation's heroes, and I hope that the presentation I'm about to give can help you or your family in one way or another. So, what we're going to talk about today for the last section of this presentation is home health care services. As Ryan mentioned, we are a home health care agency. However, there are hundreds of home health care agencies out there. So we're really going to address it on a broader scale so that you and your family members feel equipped with the information that you need if you're looking or down the road choose to look for home health care as an option. So we're going to go through what different home health care services are, the home health care admission criteria, who can and will pay for home health care. Then we have a section on veterans living with ALS. And most importantly, what questions should you be asking a home health care provider? What you can expect upon admission, and then we'll close it out. I'll pass it back to Ryan for any questions. All right, so home health care has varying levels of services. The first level of service that I'm going to talk about is unskilled home health care. So unskilled services that could be provided are typical assistance with activities for daily living, so bathing, toileting, feeding, assisting with medication and transfers. Companion and respite services could be under this section as well, to provide families some respite from providing that care. And typically this level of care is provided by CNAs or home health aides, PCAs, DCWs. I know we have individuals from different areas of the country, so this title is sometimes different, but typically it is a non-licensed caregiver. Next, we're going to talk about the nursing level of home health care services. So again, home health care agencies can deliver services that enable patients to receive the care they need in the comfort of their own home. And that care can be bowel and bladder care, G-tube care, trach care, ventilator care, and that can be for extended hours during the day. So anywhere from a few hours a day all the way up to 24 hours a day of nursing care. Other services could be more intermittent or episodic in nature. So IV infusion therapy, wound management, medication management, things of that nature. And then all of the services listed here would be considered skilled care and would be provided by a registered nurse or an LPN. and they're based upon physician orders. The next one is therapy level home healthcare services. So therapy services include, but are not limited to, physical therapy, occupational therapy, and speech language therapy. So what is the admission criteria for home health care? So the following criteria must be met for admission into home health care services. The patient must be under the care of a physician. The patient must agree to home care. There has to be an adequate and safe home environment for effective clinical care. There has to be a plan in place for medical emergencies. And there has to be an adequate funding source to support the patient's healthcare needs. And we'll talk a little bit more about that here in this section. So before I jump in into the different examples of who pays for home health care, Maxim, we have over 22,000 patients that we provide home health care for nationwide. And of that population, less than 4% pay privately. So the home healthcare agency that you work with should do everything and anything to make sure that these services are covered, not out of your pocket. So there's a lot of different payers that can pay for these levels of services. And here are just a few. It's important to know, though, that not all funding sources are created equal. Some pay for more episodic, intermittent style of care, whereas others will pay for more of that long-term continuous care. Here's a nice chart that kind of breaks down the different in-home services between VA, Medicaid, Medicare, and commercial insurance. So as you can see here, the four different rows, we've got the homemaker home health aid services, which again aligns with that unskilled level of service that I was referencing earlier. And as Michelle stated earlier in her presentation, all VAs, that it's dependent upon location and services available, but you could expect anywhere from 3 to 168 hours a week of those unskilled services. Medicaid, again, it's going to vary by state, and Medicare does not cover the homemaker home health aid service when that is the only care that's needed. And then for commercial insurance, it's going to vary by insurers, but it's not typically a covered benefit. Moving on to the expanded care or private duty nursing, I was referring to that continuous hourly nursing earlier. The VA, this is considered a covered benefit, again, subject to location and services available. For Medicaid, this again varies by state. Medicare is not a covered benefit. Medicare covers that episodic teach and train type of skilled care. And then commercial insurance, again, it varies by insurer. The skilled home health care, more intermittent type of care, this is typically covered by all of these different payers. And for the therapies, it is covered by most all of them as well, with Medicaid being variable by state. So to hit on some of the benefits for veterans that are living with ALS, first want to provide everyone here on the call with just a couple of handouts that encourage veterans and their caregivers to enroll with the VA to become eligible for these long-term care benefits. So I'm sure Ryan's going to send these slide decks out and you can click on these. There's also a couple very short videos here. So please, if you feel inclined to watch those, please do. And then just want to make everyone aware that the VA did provide a notice back in February, which mentions long-term skilled nursing as a purchased home and community-based service within the skilled home healthcare program. So there's a link to that. And I know Michelle also provided a link in her presentation as well. But really want to focus on the fact that it highlights here that this benefit is available to veterans that do not necessarily meet the Medicare homebound criteria or face-to-face requirements. So really highlighting that if the veteran needs intermittent short-term or long-term skilled nursing, treatment services, monitoring, skilled home health care could be a benefit for them. Again, variable upon location. And then this was a recent article that was posted by the American Legion, I believe last week, that that was highlighted. Dan Sheps, the Director of Purchased Long-Term Services, he described the 3 different skilled home health care benefits that are funded by the VA. So this outlines expanded care and what that is, non-bundled care and what that is, and then lastly, bundled care and what that is. So definitely encourage everyone to read through those and know what options could be available to you. The VA, as Michelle also mentioned, has an ALS system of care, and this was recently updated on their website. It adds several great resources for veterans living with ALS. So there's a hyperlink there to learn more. And as you can see on this map, all of those little dots, those little markings are resources, whether it's an ALS clinic, an ALS coordinator, but you can hover over those and find the contact information for the ALS coordinator nearest to you. And also that map can be found by going to that hyperlink that says map of VA ALS clinics and coordinators. And then we also have a military and veterans home healthcare website. So wanted to share that link with everyone on the call. And then moving into questions to ask a home healthcare provider. I think if you take anything away from this presentation, take this part away. This is really, really important. Some questions that you're going to want to know when you're selecting a home healthcare agency is your home care provider licensed? You know, some, especially non-skilled home care agencies don't have to have a license. So it's important to know if they do have a license. If so, you know, what types of licenses do they have? Next question, is your home care provider accredited by a leading national firm? So for example, Maxim is accredited by ACHC, which requires us to go through a lot of different checks and balances to make sure that the care that's being provided in the home is high quality and within compliance of the ACHC. Next question, are the caregivers employed by the provider regularly supervised and evaluated by the provider's clinical director or a registered nurse? So again, if you're receiving unskilled or non-licensed care in the home, you want to make sure that they're being supervised every 30, 60, 90 days, whatever that timeline looks like, and what that supervision process is. Does the provider perform criminal background checks on caregivers prior to hiring? You know, this is a really big one. I think, you know, every state differs in the background requirements, but they should be performing at minimum 6 different background checks. Are the caregivers covered by workers' comp in the event that they're injured on the job? That's important. They're coming into your home. Is the provider responsible for deducting taxes from the caregiver's wages? Does the provider send a registered nurse to meet the family and develop a plan of care for the caregivers to follow? I think this is a really big one. You know, you want to be involved in the care planning process. You want to be a part of that. You want to have a say in that. So that collaboration is key. So it's very important to ask those questions of what does that care planning process look like? Does the provider require the caregivers to carry photo identification? Sometimes agencies will send multiple caregivers over the course of a week into a home. So you want to make sure that the individuals that are coming into your home are carrying that photo ID until obviously you get used to them and are able to identify them. If you're dissatisfied with your caregiver, how do you go through a grievance process? Every agency should have a specific grievance process that they relay to you in the occasion that you are not satisfied. So it's okay to ask that. And if you're not satisfied with the caregiver that's coming into your home, it's so important to voice that. Does the provider keep a logbook on file to document services performed? As an agency, we always check the loggings and make sure that we have signatures both from the workers and the family members or patients, so that we know that the workers are going in and doing what they say they're supposed to be doing. That kind of coincides with the supervision part of things. We want to make sure that the care that's being provided in the home aligns with that care plan. Does the provider offer overnight and or 24/7 care? And then is the provider available on call 24 hours a day, 7 days a week, 365 days a year? We do have around the clock on call. I'm not sure if all agencies do, but this is something really important. If something happens in the middle of the night, you want to be able to call and speak to a nurse. You may not feel the need to call 911 or anything, but just to have that like triage is really, really important. So what to expect upon admission? An initial comprehensive assessment should be performed by a registered nurse. Appropriate clinical personnel are assigned based on skill sets and experience, as well as scope of service. So if someone's coming into your home and providing care for enteral feeds, they need to be trained on that skill, and you should be privy to that information. Patient and caregivers will be oriented to the services and administrative policies. And last but not least, a plan of care is developed collaboratively by the registered nurse, the office's clinical director, the ordering physician, the patient themselves, and the patient's family or caregiver. And one of the last things here, we wanted to provide you some Living with ALS resources. So again, this presentation will be sent out. Feel free to click on that. And then Maxim locations, we are operating in 42 states now. So you can see the blue states there are states where we have at least one physical location. And then the pinkish red states, we're able to service from neighboring states, but we do not have a physical presence there. So there's a hyperlink on the right-hand side if you want to locate office locations closest to you, or I also put my information as well. My email's right there, and then my cell phone number if you have any further questions. All right, and I will pass it back to you, Ryan.
Thank you so much, Danielle. That was really great information. I really loved the suggested questions. I think that's so vital when you're trying to work with these services. So thank you. I'm going to open the webinar up for a brief question and answer. I know we've gotten a few on the chat. If you have a question and you haven't already submitted it, please just feel free to submit it using the chat or the Q&A feature. We'll do our best to answer any questions that come across. The first one I just want to mention, because it looks like Justin and Marissa have already kind of addressed it in the chat, but just in case they didn't see that, the person had mentioned that their husband has ALS and is 100% connected. They're having difficulty with the process of getting a handicapped van. It sounds like, Justin and Marissa, that your suggestion was just to maybe contact you guys to maybe get a little more information, see where you could possibly point them in the right direction. Is that correct?
Yeah, definitely want to address where the road bump is first before we start throwing solutions out there.
Perfect.
Sometimes it's as easy as getting the right form upstairs to get a signature on it.
Perfect. Okay. Great. And then one of the first questions we had gotten, and again, it looked like Justin had kind of answered that as well. the person had heard that if a veteran has got genetic testing that proved that their ALS was a genetic cause, that they can lose their VA ALS support and benefits. And again, Justin, it sounds like you had never heard that. I've never heard of anything of that sort, but I just wanted to let you or Michelle maybe confirm that.
Nowhere in the exam process currently in a DBQ does it ask if genetic testing has been done. The VA seeds that military service has the propensity to cause ALS.
Okay.
And even if you do have a genetic test, you can argue, was that chance excited by your time in the military? So I'm not too worried about the genetic aspect of it at all.
Perfect. Thank you. And the other part of that question was, has there been any studies regarding, because you had mentioned we're really not sure what causes this link between military service and the ALS prevalence. She wanted to know if you guys are aware of any studies that are looking at duty stations with ALS prevalence, where people are deployed.
None that I'm particularly aware of, but that's where ALS again is very unique in the VA standards, where there is no, like, you had to be at Camp Lejeune between these years, or with like the PACDAC where you had to serve in these certain locations. It is just, you were in the military for 90 days. It's really where the VA's left it. So I don't know about any sort of additional research that's been done yet.
Okay.
I don't have any studies to reference exactly here today, but I have seen a few studies that are out there that are looking at the prevalence of ALS within the military population. I don't want to speak out of turn, but I believe that there is one branch of the military post 9/11 that seems to have a higher incidence of ALS. So I think that research is underway and probably will continue to be, but I don't have the numbers in my head, so I don't really want to speak out of turn, but I think there are things being looked at.
Do you know which branch was at the top?
Air Force.
Oh, interesting.
For post 9/11 is what I recall. So please don't quote me on that.
And I would just add to that there is research that is focused on trying to see trends and see trends between people with ALS, maybe to try to figure out what might cause it. And I'm sure there is some research on the military side of that as well. A question for you, Michelle, because you had mentioned that there are VAs that do have their own ALS clinics, their own interdisciplinary clinics. If you have a veteran that attends a community ALS clinic and they wanted to start attending maybe their VA clinic, are they able to attend both, or do they have to choose between the two?
It probably is facility specific, but our facility, I mean, we do have, sometimes it becomes challenging when you have like too many cooks in the kitchen, if you will.
Sure.
But there are some, like I have one veteran who does attend a community facility for ALS because he's in some research studies. So he does follow with the community facility, but he's also following with our VA ALS neurologist. So it probably really depends on your facility and kind of what protocols are followed. But so much, I'm sorry, this kind of feels like a cop-out answer, but so much stuff is dependent on location.
No, that's a perfectly fine answer. I appreciate that. And then the last question that I'm seeing, and this one would be for either Danielle or Michelle, maybe. And it is, would the VA help get somebody connected with an agency like Maxim if there was a need, or would the family be responsible for reaching out, making that connection with the agency, and then taking that information to the VA?
I can go, and then Michelle, just chime in if I missed anything. So the VA has what's called the Community Care Network, and the Community Care Network allows providers in the community, such as Maxim, to provide these services. So your home health agency that you work with, you're going to want them to be enrolled in that Community Care Network. Fortunately, Maxim is, and there are hundreds of agencies that are. So the VA will typically give you that list of agencies that are enrolled or contracted with the Community Care Network providers. But if you do come across an agency that you want to work with, you could always just talk to your VA social worker about that as well. And I'll let Michelle chime in with anything I missed there.
Yeah, absolutely. I know for example, at our facility in Erie, we typically do we talked about like the needs assessment. And so that's done routinely, just depending on as the veteran's needs change. And so a lot of times the way authorizations are written for community agencies are dependent upon your clinical needs. So for example, I might do what's called a case mix assessment with a veteran to kind of find out where they fall in this case mix assessment, and that would kind of determine the amount of services that they may or may not be able to get through the VA, it's community care network. So I always encourage people to, stay in close contact with your healthcare team, your primary care team, your ALS team, your ALS coordinator, as your needs change, so that those can continue to be assessed to determine what level of services you might require.
Okay. And that looks like that was the last question. So if you did have questions and you're still on, and you just think of them after we end, feel free to reach out to me. I will try to get you an answer from one of our speakers today after the fact. But I would like to thank our 4 wonderful speakers for the wealth of information about your programs and services. Thank you again to all of our veterans for your service, and thank you to everyone in attendance today. We hope you found the information helpful. A reminder that you will receive a short survey when we end this webinar. The survey should also be emailed out to everyone in attendance tomorrow. And then another reminder, November is also National Caregivers Month, so we are hosting a couple caregiver webinars as well. If you're interested in these or attending these, please reach out to me, or you can explore our Care Services webinar page at als.org. But again, thank you to our speakers, and we hope everybody has a great rest of your day. Thank you.
Thank you.